contrast. It's totally painless. An MRI is no radiation, so you have to fear radiation or pain or anything for the test. And you can get diagnosed. So he wants to know, do I have an acoustic neuroma? And so he came in yesterday. We sent him for the test, and we'll have the answer early next week. Do you have one or not? And he'll walk away with a disc. He'll walk away with the report, and he'll know finally why he's fallen down and why he can't hear.
Almost like a sense of vertigo.
That's because the eighth nerve is responsible for hearing and balance.
Okay.
That's what the ear does.
Okay, I didn't know that.
And hearing. So there's one little nerve on either side of the brain, the right and the left, and benign conditions can cause that to occur.
Sure.
So it's an acoustic neuroma, usually benign, almost always benign, and can be treated non-invasively. So it's nothing to fear, but it's great to know what's going on. This man is really frustrated. He's been in the medical system, and he never has been worked up. Anyway, we are going to leave for our sponsor, and I've already told you how great our sponsor is because it sounds like
Sounds
me.
very familiar, Doctor.
Yeah, it sounds like me, and we'll be back and take your questions and give more news. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, we're back. Barb's on the line from Suffern, and I understand there's a loved one with cancer that's spread on hormones, and what else can be done is your question. Is that right?
Yes, it is, doctor.
This is your husband or father or loved one?
Loved one.
And I can tell you that actually there's 6 new medications that were recently approved for prostate cancer. We do radiosurgery for prostate cancer. So we'd really have to see the patient and understand what prior treatments. I understand that he's had hormones. His condition.
He has hormone therapy, and once in 6 months he gets something, an injection for the bones.
Right. So we'd have to see him, but I can tell you that there are new medications. There was a new medication just approved, and there are other treatments, including radiosurgery, that can be used. So please call us during the week at 212-CHOICES, which is our direct number, and I'll spend more time with you about all those options or meet with you. So thank you very much for calling, Barb. And we have Mary on the line, and I understand your father has prostate cancer and he urinates a lot.
Yes, Dr. Lederman. He had it about 10 years ago. And right now he's been having, he urinates a lot. And I've been giving him pignotamine and stinging metal. And For 6 months it worked, but now it's not working again.
Yeah.
Is there something you can suggest?
Yeah, but it's not going to be a radio answer. Really,
Right.
we need to see him, or someone needs to see him, either his urologist if he's giving you satisfaction, or somebody else, and examine him and get blood tests and really find out the cause of this, because there's many causes. It could be anything from infection to nerve damage or other things. So we really want to see him and go through every detail and then send him in the right direction to get better. So please, again, call us during the work week, or you can actually call most anytime, 212-CHOICES, 212-CHOICES, and I'd be happy to speak to you privately and even meet with your dad if you want.
Thank you so much, Dr. Lederman.
All right.
I really enjoyed your show.
All right,
Thank
God
you.
bless you, and thank you.
Thanks, Mary.
And we have Dr. Eisen on the line. Dr. Eisen is a Spanish-speaking doctor from Argentina, educated there, trained at Columbia, and his specialty is taking care of the Spanish patients and Spanish-speaking patients with cancer. Good morning. Buenos dias, doctor.
Good morning, Dr. Lederman. How are you?
So did I explain everything right about you?
Yes.
That you're a Spanish-speaking doctor, you trained in your great hospital in the medical school in Argentina, trained at Columbia, and you're dedicated to taking care of the Spanish patient in America.
Yes, you very good, very good.
And I understand that we had a Spanish fair, and you actually ended up going to that fair thanks to a caller on this program. Melissa called us about a Latino fair a couple weeks ago, and I understand you met with many patients and their loved ones who had cancer in the Spanish community.
And the good thing about that is that the patients, they were able to talk in their own language. They called me during the week. There were a lot of different interactions and actually helping them to understand what are we doing in our own language, in Spanish. And some of them, they came to my office with some of the records for, as you said, for a fresh second opinion. And they were very pleased to see that there are other ways to manage the case. In fact, one of the patients that was told that maybe radiation was not going to be part of the solution, actually it is going, and we're going to send the patient for a PET-CT to see exactly the area that we're talking. So it's always good to go to see a doctor, particularly for a second opinion or a first opinion, and of course makes a huge difference doing it in Spanish.
And I understand. Go ahead. Sorry to interrupt.
Yeah, I would like to leave for the Spanish-speaking audience my telephone number.
Before you do that, I just want to remind people, I want to congratulate you, because a woman who was listening to this program a few weeks ago who had a lump in the breast came to you thanks to the program and got the lump diagnosed. She did have a cancer. It was removed. She had lumpectomy. She's going to have a short course of radiation, and most likely she's going to be cured. So actually, the listeners, there's women out there with breast cancer. They don't know it yet. They got a lump in the breast, and they've kind of been in denial. Now, they came to you, and the workup is easy. The workup is painless. And this woman that you're taking care of is so happy that you diagnosed her cancer. She just had a little needle in the breast lump. Didn't hurt. She got the diagnosis. We did a scan to make sure the cancer didn't travel. It did not travel. And most likely you're going to cure her. So I want to talk about her, who you're taking care of.
Well, one other thing I want to tell you is that also the huge difference makes our center, because the experience that she had in such a short time, be able to do everything in such an easy way, she was extremely pleased. She did, as you said, she did have a bad experience in another institution, and she was very afraid. And she just told me last week that her experience was incredible, from seeing us, sending her for a biopsy, getting her lump removed, now setting her up for her treatments.
Right, she's smiling all the time. Every time I see her, she's smiling. She's so happy. And you have another patient, which I just want to have our listeners know about, a woman who's also a young woman with sarcoma. And many people think that sarcoma doesn't respond to radiosurgery, but actually it has one of the highest control rates. And you're treating this woman, and she's been at biggest hospitals in New York, and their treatment didn't work. And you've treated her leg, you've treated the lymph node, you've treated the lung, and everywhere you've treated, it's worked beautifully.
You're absolutely right, and I think that is the combination of the type of treatments that we can offer to the patient, and also I give a big credit to the whole team that you are responsible for creating, and it makes a huge difference, particularly in patients that are coming with pain, with bad experience.
Okay, so radiosurgery helps pain. So if you have cancer pain or bleeding, we should call patients that want to call you directly. How do they find you?
Yes, they can call me. In Spanish is 917. In English 917-836-8105.
Can you have that again, please?
In Spanish 917-836-8105.
Can you do it once more, please?
Sure. 917-836-8105.
All right, thank you very much, and callers should feel free to call him day or night. Thank you, Dr. Arzen.
Thank you. Bye-bye.
One of the new points of information actually at the cancer meeting was with this CyberKnife treatment. Many people are rushing for CyberKnife treatment. Many physicians, many specialists in the field consider it experimental. And why is that? Why would they say it's experimental? Well, in published data, there's only 200 men treated with data more than 5 years. So there's a paucity of data with CyberKnife, and there's a lot of criticism that it's being so heavily promoted. When really there's great treatment out there that has been proven over 20-plus years. So why against CyberKnife? Paucity of data. There's only 200 men followed more than 5 years. Mm-hmm. There's no randomized studies, so there's no studies that compares treatment A to treatment B. And so when men choose a treatment that has a paucity of data, they're taking a giant leap, and they may be left with results that they don't like, or results that are inferior to treatments that are well-known, well-established. So when we talk about custom-tailored treatment, we're talking about treatment that is well-designed for the man, that can go from a treatment that only lasts 45 minutes to one that can be weeks long if the man and his loved ones wish that. So it's really important to know the data and get a fresh second opinion, like the woman who had the unnecessary axillary dissection we talked about at the beginning of the hour, to people who are rushing to get a treatment that is less than proven, let's say.
Yeah.
So it's really important to know that. We're just about at the end of our time on ABC. We're going to continue the discussion and new data from the National Cancer Meetings tomorrow on WOR, which is 710 on the radio. We have two shows on WOR. The first one is at 6 a.m., 6 till 7 at 7:10 a.m. on the radio dial. That's WOR, 6 a.m. And also tomorrow night we have a special program with Dr. Paul Offutt about how hormones and vitamins and antioxidants can harm you and can increase death rate in cancer patients by 25%. So I'd urge you to listen to those two shows. Call us at 212-CHOICES if you have a question during the week. 212-CHOICES. I'm happy to answer your questions, meet with you, and send you a booklet about our work. Again, thank you very much. God bless you, and talk to you soon.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News,